Obviously, New South Wales has expressed our concern yesterday. Dr. Chant gave the Crisis Cabinet very strong advice that she considered that what we were going through here in New South Wales is a national emergency. By that, what she was really saying was we need the help that other states and territories could possibly give us. I want to remind those other states and territories that last time I looked, we were a Commonwealth. We worked together. And it disturbs me that it would appear that all we've ever done to work together has just seemingly been cast aside. When we have bushfires, when we have floods, people from our state go to help others. We know that, and I can't thank New South Wales residents for the years and years of contribution to other states. Equally, those other states send their community, their emergency workers, their fire workers, their SESs. They come to us and help. Last year, when Victoria was in trouble, and from this end we were thankfully not suffering the same problems that our Victorian colleagues and friends were suffering, I personally said goodbye to a number of health staff who went down to Victoria and put their lives at risk, put their lives on the line. I personally, as Health Minister here, stood proudly with them in this very building and welcomed many of them back. And what they told me was that they really did feel that they had risked their lives in going down there, but that was what they were prepared to do to support our friends in Victoria, our fellow Australians in Victoria. I just want to emphasise that from my point of view, it's with disappointment that I heard some of the responses from leaders from other states. I can't quite see the difference between beating back fires and beating back and addressing the problems of floods and beating back this COVID virus that could actually, if it gets worse here in New South Wales, could actually create massive problems for the whole country. New South Wales is the gateway to the rest of Australia. We've done enormous work to bring back so many Australians. More than half of all Australians who've come back have come back through the gateway of Sydney. And we continue to step up and make sure that we support our nation, our Commonwealth. And I certainly ask for the other leaders in our other states to reflect on that, because we need the Pfizer that they may have not such a great need for at the present time. We have a very young population in southwest and western Sydney, and based on the advice that the federal government have given after they took advice from their experts, their medical experts, there are many people in those areas at this stage that are really in need of Pfizer. We need them to have the Pfizer. So I would just ask again for that to be considered.